Good evening, everyone. So, welcome to the fourth lecture in series of basics in acupuncture. So, today we'll be discussing three. Today we'll be discussing three channels. That is your heart, small intestine, and pericardium. So all these three channels are important, and today we have our head of department, Dr. Maitri Pandey, who will be taking us through all these channels. And I would request you to please listen carefully, and at the end of the session, please be ready with your questions. We'll try to answer as many as questions possible, and we'll be demonstrating the important points of all these three channels on this thing. And we expect that when you come on Saturday for the contact program, you must have read all these channels, because we'll be you'll be practicing all the important points on each other. So you'll be practicing needling and the important points on each other. So without further ado, let me invite Dr. Maitri for her talk. Over to you, ma'am.
Good evening. I think remembering all the points at one go is very difficult. So can we revise yesterday's points? Lung was yesterday, I think lung and large intestine were. So can anyone tell me what is lung 5? Lung 5. Where does it start? This is usually on the lateral aspect of the arm and forearm. Okay. And where it ends? It ends thumb, radial side of the border of the thumb. And it is a paired channel. Okay. So, जो ये brachialis है ना, इसके lateral कौन सा point होता है? Which point is that? Dr. Anil has come. So he has taken these points. I think Dr. Anil, please come and revise the points of yesterday. We will talk only about 2 points, LU5 and LU7, and LI4 and LI11. So LU5 they were telling. Where is LU5? Lung 5. Yeah. When you flex
and feel the biceps and then just lateral to the biceps
and make your biceps prominent. So when you feel the tendon of biceps at the cubital crease, it is on the lateral aspect of that biceps tendon. Am I right, Dr. Anil? Okay. So another important channel, which is that, Dr. Anil, of lung. Yes, you were told yesterday, all of you.
Lung and
lung 7. Lung 7 कहाँ होता है?
Lung starts from and ends at. So at thumb, which point is there?
How many points are there in lung?
Which point is there at thumb? How many points are there? L12? L12? What? 10 set, 10 point. Play cricket team, na? L12? Lung. L12, lung 11. And it's 10. And then where is lung 7?
Anyone from the audience can please tell in the chat box. Dr. Nishant, please check. Chat box में किसने बताया है? Where is lung 7?
I can't log in because I've already logged
Okay, okay.
in. So you can even unmute and talk. So
Yeah.
even the participants can unmute and talk. No issues
मैं
regarding that.
खुद नहीं मैं खुद नहीं दिखूंगी इसमें मैं अपना आधार कैसे दिखाऊंगी I will not know now what is being
मैम
shown.
रिकॉर्डिंग हो रही है इसलिए नहीं होगा मैम वो आपको यहाँ से दूसरे
दूसरे उस पे दिखाना पड़ेगा oh. So anyone has answered? So let's go on. Only can give.
Camera is active now.
Okay.
Camera is active.
Okay, okay. So, but I don't know what is being shown. So, lung 7. किसने बताया? चलो. What he told like this?
Anywhere at the wrist, it's located. Anywhere at the wrist.
कहाँ है?
Yes.
ये बताया था ना इन्होंने?
Just doing like. Yeah. Huh?
1.5 shown above the crease of the wrist. है ना? Adductor pollicis longer इसका insertion जो है इसके ऊपर. Is it? Am I right?
Yeah, yes. This is just above the styloid process. Styloid process of the radius. Huh? Just here. Just
Yeah.
you can cross the finger.
Can you see, Dr. Anil, in your camera?
Yes.
हाँ, ठीक है.
This is lung 7.
And few important points of LI, large intestine are I think LI 4 and LI 11. दो बता दो.
Like 4 I told you now, where? Where? Yeah.
And it is the master analgesic point, sedated and tranquilizing point. Okay, LI 4.
And N11? Where? Feet. At the end of the feet. At the end of the feet. This is N11.
तो लंग चैनल के पीछे होता है LI चैनल. एंटीरियर पार्ट में लंग होता है और पीछे होता है पोस्टीरियरली इज द LI चैनल. ठीक है. तो उसी क्रीज में व्हेन यू फ्लेक्स योर हैंड arm, so at the cubital crease it is the what radial most part of that cubital crease is the LI 11. No, am I right? LI 11. So now I start my class because it's very important. I wanted to know because whether if you are not reading on the same day, then every point will be a big khichdi in your brain. Because later when diseases are being told, then you have to remember all channels, especially the important points. Okay. So I'm starting with the heart channel, and it is a paired channel, and total number of points are 9. And as usual, the pertaining organ is heart. The related channel is small intestine, and the element is fire, and the energy flows is centrifugal. Centrifugal मतलब center से periphery की तरफ. ठीक है? Am I right? Oh, okay. So now, as the name suggests, the channel starts from the heart, it traverses the lung, and it emerges from the axilla. Okay. So axilla में इसका जो peripheral, which is the surface, it emerges at the axilla, and then it comes at the posterior border of the medial aspect of the upper arm, forearm, and down to cubital fossa, and it via the palm comes on the medial side of the little finger to its tip. ठीक है? I have a diagram to show. ठीक है? तो ये कहाँ से शुरू होता है? या एक्सिला के एपेक्स से शुरू होता है, and it comes on the anteromedial aspect of the arm and forearm. Okay, and then it comes here on the lateral medial aspect of the palm, and it finishes ends at little finger. Little finger का किधर? Okay. Clear? Slides नहीं आ रहे. नहीं करा. किसी ने लिखा नहीं शायद, कोई अनम्यूट करके बोलने भी नहीं वाले लोग हैं।
देव जॉइन
ओके,
तो वीडियो भी नहीं आ रहा। अब आ गया?
आ रहा है, अब आ रहा है ना।
Yeah, it's visible now. Okay, okay, fine.
कमिंग नो, ओके।
मैं आपको कैमरा भी दीजिए। चलिए
कोई बात नहीं, वहाँ नहीं आ रहा।
आ जाएगा।
Yes, sir. Slides are visible now. I can see.
Okay, okay. So you should have told earlier that it is not visible. Was I audible earlier?
Yes, yes, you were audible.
So now you can see the course of this heart channel. It starts from the axilla. It comes from the medial anterior aspect of the medial border of the arm and forearm, and it goes through the palm and it ends at the little finger. So the clinical uses are, as the name suggests, for all heart diseases. Okay, and then it is along the course of this channel, any pain, any other problems can also be tackled by the use of these channels. It has been also been found useful in mental disorders and speech disorders, autonomic disturbances. Usually the first point I've just written, though it is not usually punctured, it can be used, it can be located by abducting the arm at the center of the axilla, okay? And it is medial to the axillary artery. So just to tell you that it starts from here on the surface of our body, okay? And the next important point is H3, heart 3. And it is located between the medial end of the transverse cubital crease and medial epicondyle of humerus. Okay, so when you flex your arm, so this is the medial end. Okay, this is the medial end. Okay, then this is the medial end of the crease, and this is the, you can feel the epicondyle, medial epicondyle of the humerus. It is between these 2 points. Okay, am I clear? This is very important point, and it is used for heart pain, angina, pain in the hypochondrium, and of course pain in arm and hand. And the method is to puncture perpendicular 0.5 to 1 shun, and moxibustion can also be done on these points. Okay, I think you must have been told about moxibustion. So next point is H5. Okay, before going to this point, I will tell you about H7. H7 is a very important point, Shenman, and it is on the radial side of the tendon of the flexor carpal ulnaris in the transverse crease of the wrist. Okay, when you flex your hand, then you can feel for the tendon of flexor carpi ulnaris, okay? And on the radial side of this, at the wrist crease, is this point, H7, okay? So it is used in angina, palpitation, amnesia, insomnia, and mental disorders. It is very useful, okay? It is also a sedative point, used for sedation and tranquilizer. And you puncture 0.3 to 0.5 shun perpendicular. Okay. So now we can come back to H6 and H5. H6 is just 0 shun above H1. H7, sorry. If you locate H7, it is just 0.5 shun proximal to H7. Okay, the indications are the same. But you puncture 0.5 shun perpendicular. Okay, ज्यादातर points perpendicular ही करते हैं, जो oblique या horizontal होते हैं उनको याद रखना है, ठीक है? and H5 is further 0.51 shun over H7, that is 0.5 shun above H6. समझ में आ गया? मैं फिर से रिपीट करती हूँ कि हमने कहा where do we start? H1 starts at H1, that is the center of the axilla. It comes from the, कहाँ पे आता है? Anterior medial aspect of the arm. और यहाँ पे आके क्या आ जाता है यहाँ पे? When you flex the arm, then it is, you locate the medial end of the cubital crease and you palpate the medial epicondyle of humerus, and it is between this point, and you puncture perpendicular. Okay, fine. Now you, for it is, next important point is H7. So H7 is at the wrist crease. Okay, crease of the wrist, flexor carpi ulnaris, जहाँ insertion है उसका, on the radial side. Remember, this is a painful point. Okay, but it is useful in very acute cases. ठीक है? Acute heart pain and mental disorders. So it is useful point. And if by some reasons you cannot puncture this, then you can use H5 and H6. So H6 is just 0.5 shun above H7 and H5 is just 0.5 shun above H6. Okay. Indications I have written. You will remember slowly. But remember that in Chinese medicine, brain is not any channel, though it is controlling a body. It is taken as extraordinary organ. So for treating brain diseases, mental diseases, heart and pericardium channels are used. Okay. That is why so many mental disorders are written over here. Then comes H8. It's when a fist, you make a fist, all of you. When you make a fist, ठीक है? उस पे tip of the little finger जहाँ rest करता है, it is between 4th and 5th metacarpal bones. Okay. Apart from cardiac importance, it is used for aneurysm dysuria and pruritus of external genitalia. Okay. So in some children, those who bed wet and it is difficult to puncture, but at least you can give acupressure to these points. It is a painful point, so don't take it lightly. And if it is indicated, then only it should be used. Okay, this is the diagram which I just told you that H3 is here, okay, at the cubital crease, and then comes H7, 0.5 shun above is H6, 0.5 shun above H6 is 0.5, and 0.5 shun above H5 is H4, okay. How many number of points it had, heart channel? 9, very good. So last point is 9. And so good. You feel very good when the last point is coming. So H9 is at the radial side of the little finger. Okay. Little finger सब दिखाओ अपना. Little finger का radial side इधर है ना. ठीक है. 0.1 shun posterior to the corner of the nail. ठीक है. तो इसको subcut अगर करना होता है तो this is for acute disorders. ठीक है, जैसे febrile disease है, loss of consciousness है, usually this is not pricked. So in the books it has been written, you only puncture it if you have acute problems like this, loss of consciousness or febrile disease, acute. You want to treat them. ठीक है. So I think heart channel is clear. ठीक है, याद हो गया सबको? I hope so. If you want me to revise, I can do again. Anyone wants me to revise? You can unmute yourself, those who are not visible to me, so that we can answer these questions side by side. Any problem in this channel? That I will know tomorrow, if it is there or not. Okay. So the next channel is small intestine. तो जहां पे हार्ट चैनल खत्म होता है उसी के बगल में स्मॉल इंटेस्टाइन शुरू हो जाता है. ठीक है, तो वो सेंट्रीफ्यूगल था तो ये सेंट्रीपीटल हो गया. ठीक है, तो टोटल नंबर ऑफ पॉइंट्स आर 19 एंड एलिमेंट इज सेम एज हार्ट. and the energy flow is centripetal. ठीक है, तो यहाँ से start होता है and it takes the course from the, उसके पीछे चलता है ये, it goes behind, it runs on the posterior aspect, posterior medial aspect of the palm, forearm, and then between the olecranon process and the medial condyle, it goes to the shoulder, makes a zigzag over there, and comes to the supraclavicular fossa, and runs from the lateral side of the neck, and then it ends at the in the front of ear. ठीक है, ट्रेगर्स के सामने it ends करता है. ठीक है, I have not read this. If someone is interested, you can read it. So the branch of the supraclavicular fossa usually goes to this thing, to its pertaining channel, small intestine. वहां से heart में जाता है, heart से small intestine चला जाता है. ठीक है, that is how they are linked together. So this is the course which I just talked about. So it starts from the little finger and it goes from the posterior aspect of the palm and comes in this thing near the radius of ulna, and then it ascends here behind the olecranon process and it comes to the shoulder, makes a zigzag course over here and goes below the zygomatic process, and then it ends in front of ear. Is the course clear to all of you? If you visualize, memorize this course, then only you can remember the points. Okay. So clinical uses as usual, small intestine to pain in the lower abdomen and along the course of this channel. And it has been used for deafness, jaundice, sore throat, and swelling of the neck. And the important points are SI3, small intestine 3. Okay. So it is very important point. अगर आप अपने palm को flex करोगे, ठीक है, palm को flex करोगे, तो it transfers keys जहाँ पे end होता है यहाँ पे on the medial side of the palm, where the red and white skin meets. It is this point. Okay. So it is very useful. It is a painful point and you should use it judiciously. It is used in acute conditions, cervical spondylosis. Okay? Pain in the palm, pain in the elbow, acute conditions, and febrile disease, night sweating, etc. Okay, clear? Important point है ये. इसी के ऊपर है SI2, है ना? SI2 इसी के ऊपर है, जहाँ पे distal end of the fifth metacarpophalangeal joint है, on the ulnar side of this, just above it, it is there. Okay. You have to puncture 0.5 Shun perpendicular. It is a painful point. Next important point is small intestine 6. It is a Z cleft point used in acute conditions. It is located where it is usually identified with your pronation of the pronating your, ठीक है, forearm. ठीक है, pronate करोगे तो can show here. Here I can show it on this hand. Okay, ठीक है. So what is this? This is the, you've forgotten your anatomy, I think. Styloid process of ulna. Okay. So it is, okay. Radius तो नहीं दिखा रही हूँ मैं, नहीं ulna ही तो दिखा रही हूँ. ठीक है. ulna, ठीक है. And it's इसके नीचे inferior medial to it is a depression. And this is SI6. ठीक है. It is located on the inferior and lateral side of the depression below the styloid process of ulna. Okay. So it is also indicated in pain in shoulder, neck and elbow, and blurring of vision. Since it is there is no tissue, so you have to puncture it obliquely. Okay. You have to puncture it obliquely 1 Shun. Clear? And you should puncture it medially, obliquely. I will tell you later P6 towards P6. In the next, this thing is pericardium, which should point towards P6. Next point is SI8. I told you the force that goes behind the olecranon. तो ओलिक्रेनॉन और जो मीडियल एपिकॉन्डल ऑफ ह्यूमरस है उसके बीच में जो इट इज मिडवे बिटवीन दोज टू पॉइंट्स ओलिक्रेनॉन एंड मीडियल एपिकॉन्डल, ठीक है, इसके बीच में होता है ये. Indications are almost the same, and you puncture 0.3, 2.5 Shun perpendicular. Okay. Can anyone tell me what are the other points at this joint, elbow joint? We just talked about one, H3. Yesterday you were told about lung 5 and LI11. Okay. So any problem in the elbow, you usually choose these points. Local points, there you will told later on some local points and some distal points. So local points तो उसी के round होते हैं जो वहाँ पे हैं, ठीक है? Next point is SI9. It is very important. It is used in frozen shoulder and motor impairment of hand and arm. It is when you adduct your arm, ठीक है? The posterior fold of axillary fold होता है, posterior axillary fold का highest point से 1 shun above it, ठीक है? So and no one is wearing sleeveless. I cannot show on myself. So when we puncture, we can show. Okay. So SI9 क्या है, मैंने बोला था ना, शोल्डर पे चला जाता है ओलिक्रेनॉन और मीडियल एपिकॉन्डल के बीच से शोल्डर पे जाता है, तो शोल्डर पे यहीं से आता है, ठीक है? पोस्टीरियर एक्सिलरी फोल्ड के हाईएस्ट पॉइंट से 1 शो अबव दैट इज स्मॉल इंटेस्टाइन 9, ठीक है? वेरी इंपॉर्टेंट फॉर फ्रोजन शोल्डर. And you puncture deep because it is tissue is there, 1 to 1.5 shun perpendicular. Next is SI10, that is just above SI9 in the depression inferior to the scapular spine. It is just above this point, ठीक है? जो scapular spine है ना, उसके just नीचे होता है, and just above this SI9, and it is also used for shoulder pain. Next few points I have just written, though they are not so important, but back, many people have pain at the scapular region because of lifting weights and tenderness is there, then you can use these points. Okay. Next is SI11. It is where the scapula का inferior point होता है ना scapula का, ठीक है ना? And the lower border of the scapular spine and the inferior angle of scapula के junction of the upper and middle 1/3, yeah, or junction of the upper and lower 2/3, ठीक है? I will show you the diagram, and this is the diagram. Okay, so this is what I told you about SI9. Posterior, highest point of posterior axillary fold, 1 shun above it, ठीक है? Just above it is, just below the scapular spine is the SI10. Okay, then SI11 is this. SI11 ये है, ठीक है? जो inferior angle of scapula होता है और ये lower border of scapular spine है, upper 1/3 and lower 2/3 के junction में होता है. So normally it is, these points are painful when these conditions arise, so you can locate these points. Even if you don't want to puncture these points, you can do moxibustion or you can put acupressure in these points. Okay. So next point is SI14. It is 3 shun lateral to the lower border of the spinous process of T1. That is thoracic 1 vertebrae. Okay, thoracic 1 vertebrae. तो उसका spine, you must be now, you are all anesthetists, you know about the spines, no? तो T1 को locate करो. How will you locate T1? Can you answer? Deepak is calling me. Very good. To locate C7, it is the most prominent vertebra at the neck, and just below is T1. So 3 shun, that means 4 fingers. Lateral to it is SI14, and it is also used for pain in shoulder and back and neck. Okay, to puncture it perpendicular. And then SI15 is very important. 2 shun. 2 shun lateral to the lower border of the spinous process of C7. ठीक है? तो C7 के just नीचे जो midline channel होती है, that is DU14. You will be taught about it later. So DU14, it is a unpaired channel. 2 more. Dr. Kohli talked about it. It's a posterior central channel. So just below is C7 vertebra के just नीचे वो होता है, and it is, we will be told later. Just to, you should remember, that is why I'm telling you. And this is used for pain in shoulder, back, may be used for asthma. SI is 15 I'm talking about. And it is also used for lung disorders. Okay. And this you puncture obliquely. Okay. Next is SI17. It is a dangerous point. Okay. Not used commonly. It is posterior to the angle of the mandible. उसके पीछे तो anterior वो superior sternocleidomastoid जो muscle है उसके anterior border पे होता है. ठीक है, इसके just पीछे. So it is used for deafness, tinnitus, sore throat, tonsillitis. Okay. It is also punctured perpendicularly, and you have to take care when you are puncturing this point. You should not go posterior. Why? Posterior जाओगे तो क्या होगा? It may puncture great vessels. Carotid होता है वहां पे. ठीक है? When you are very much seasoned, then you should try this point. Next is the SI18. That is the regional analgesic point. ठीक है? Used in dental extractions, trigeminal neuralgia, facial paralysis. Okay. So how will you locate this point? How will you locate this point? Outer canthus of eye है ना? इसको perpendicular drop करो zygomatic bone पे. Just below the zygomatic bone is this point. Okay. But you should be very careful while pricking this point, because if you are too deep, you will go into the cheek and cause bleeding. So it is used for toothache and trigeminal neuralgia. Last point is very important, and it is SI19. ठीक है? कहाँ पे है? It is usually located with your mouth open. When you open your mouth, ठीक है? Then it is in front of the tragus, depression जो आता है, and it is anterior to tragus and posterior to condylite process of the mandible. ठीक है? It is, since it is located near the ear, so it is used for deafness, tinnitus, vertigo, otorrhea, and toothache also it can be used. And you have to puncture perpendicular 0.2 to 0.5 shown. ठीक है? Any problem in small intestine points? Any problem? And any point you could not understand? Because I know it is difficult to remember so many points at one go. My sincere advice to all of you is to go and read it. So once you go back, you just read it and just make a mental picture of where are those points and how I have told you. Okay, so that you can remember. Okay. You need a breather? Take 5 deep breaths, all of you. Then we can go to the next channel. The next channel is pericardium. Okay. So in Chinese medicine, usually heart and pericardium is taken as one organ. Okay. But since it is a counter channel of Sanjiao channel, that is all the body cavities. So it is taken as separately. So It has also got 9 points. ठीक है, हार्ट में भी 9 है, पेरिकार्डियम में भी 9 है, ठीक है, और स्मॉल इंटेस्टाइन में 19 है, 9 के पहले 1 लगा दो, 19 है, ठीक है. So it as it is suggesting the pertaining organ is pericardium, related channel is angio, element is same fire, and the energy flow is centrifugal. ठीक है, हार्ट का भी सेंट्रीफ्यूगल था. ठीक है, तो it runs between lung channel and heart channel. It runs from the middle of the arm and forearm. ठीक है, and it ends at the tip of the middle finger. Okay, so this is how it is seen as a when you draw the diagram. So it comes out lateral to the nipple, and the body, the first point is there, P1, and then it comes to the arm. So common most important point is this P3. Okay, so it is of course used in heart disease, upper abdominal diseases, nausea, vomiting, gastritis, mental disorders, and diseases along the course of the channel. Now we come to P3, that is pericardium 3. Okay, it is located at the another coming at the elbow. Okay, already you know about the 4 points at the elbow. This is the 5th point you are located, and this is the counterpart of what? Lung 5. ठीक है, lung 5 lateral होता है biceps brachialis के tendon के, और ये क्या होता है? ठीक है, on the ulnar side of the tendon of biceps brachii. Okay, and it is used for cardiac pain, palpitation, febrile disease, vomiting, pain around in the local area. And you puncture around 1 shun perpendicular. Next is P4. Okay, this is used for acute conditions. Okay, acute heart pain, angina, acute palpitation, epistaxis. Okay, and it is 5 shun above the transverse trees of the wrist. Transverse trees of the wrist में और कौन से points हैं? Yes. सब गोल हो गया. अभी तो बताया H7 था ना? हाँ, नहीं, ट्रांसवर्स ट्रीज में तो H7 ही है. ठीक है, and it is P4 is here. It is 4 shun above the transverse trees of the wrist between the, ऐसे करोगे तो palmaris longus and flexor carpi radialis के tendons आएंगे, उनके बीच में है ये. ठीक है, 5 shun means you measure 3 shun and then other 2 shun. That come how you know about the 5 shun. ठीक है, और cubital crease से wrist तक कितने shun होते हैं? 12 shun होते हैं. Okay, you puncture perpendicular, and next is the most important point, that is P6. Okay, most important points. Many studies have been done on this point, and it is located 2 shun above the transverse crease of the wrist between palmaris longus and flexor carpi radialis. Okay, so when you just clench your fist and then push it against resistance, you can feel these tendons. So 2 shun मतलब कितना हो गया? 2.5 fingers of the patient, 2.5 fingers above this crease of the wrist. The point is located between palmaris longus and flexor carpi radialis. I'm repeating this so that you can feel yourself, and then you will never forget. This is very important point. It is used for palpitations, most commonly used for nausea, vomiting. Even it has been used for hyperemesis gravidarum. Okay, many have used this point for anesthesia for thyroid surgery and cardiac surgery. Okay, you have to puncture 1 shun perpendicular. Okay, next is P7. ये कहाँ है? उसके ऊपर होगा, नीचे होगा? P6 के नीचे होगा ना, क्योंकि ये सेंट्रीफ्यूगल है ना, तो इसके नीचे होगा. ये मिडल ऑफ द ट्रांसवर्स क्रीज ऑफ द रिस्ट है ना, बिटवीन द टेंडन्स ऑफ palmaris longus and flexor carpi radialis. ठीक है, इसमें अब रिस्ट के क्रीज में आ गया, यहाँ पे आइए P7. ठीक है, and usually it is not punctured, it is quite painful. P6 is most commonly used. And P8, just for interest, I have written that it is on the transverse crease of the palm, between second and third metacarpal bones. And last is the P9, that is center of the tip of the middle finger. Okay. Yeah. Backbenchers, why are you so sad? You understood? Very less expression from you. Huh? That is why I tell you, come in front. So that comes to the end of the lecture part. Any questions? So I have written take-home message also. Let me read about it. Okay. I told you that heart and pericardium is associated with brain. So all the problems of brain, mental disorders are treated by using these channels. And for brain disorders, apart from these channels, two more channels, that is the central channel, which is running at the back. Urinary bladder channel and the stomach channels are also used because they run from on the scalp also. So these channels are also used. And there are 12 main sedative and tranquilizing points. Which 2 points I have told you today, which I have covered already 2 points here. Okay, at 7 and P6. है ना? और Li4 भी sedative point है. Apart from this, it is a master analgesic point. ठीक है? बाद में master analgesic point और बताए जाएंगे. One of them is DB34. ठीक है? So when a patient comes to you, even if you don't memorize the channels, the patient is in pain, you can stimulate these channels so that the patient will have some pain relief. Any questions? I would be glad to answer. नहीं ठीक है तो come here. Ring master has come. You want another samosa? I have
Okay, fine. So now we have completed 5 channels. We have done lung, large intestine, heart, pericardium, and large intestine. Small intestine. Okay.
They should read these channels and questions will be asked.
Yeah, you should be reading these channels and questions will be asked when you come for the hands-on. And obviously on 29 there will be a short MCQ and short answer question test and practical demonstration also. Now the points today yesterday and today are very important because these are the initial points that you can use for any patient who comes. Okay, points like Li4, P6, right? So initial points, these are on the periphery, easily accessible, and these are general points. Like Li4 is the master analgesic point. So any patient who comes in pain, the first point that you can give is Li4. You can give P6, easily accessible. Now, most common pathology, as you must have seen in our pain clinic, also comes with tennis elbow. A lot of patients with tennis elbow come. Okay, so lung 5, H3, P3, and Li11. All 3 points on the crease along with Li4. So these are easily accessible points, local points, and if you add H3, that will also add. So you start with 2 or 3 points. You start with the analgesic point. You start with the sedative points, and the patient will have some amount of relief. And you can always use local points depending on the pathology. So the idea is whenever you're starting therapy, you choose the points which are easily accessible, superficial, and basically less invasive, right? And should provide some amount of relief initially. So that is how you start. Then you go to the disease specific points, right? To make the patient comfortable, and then you start these points, right? Now, regarding this thing, as ma'am was saying that many studies have been done on P6 also. Now, we have been using NMT monitors, all of us. कहाँ पे लगाते हैं? If you see, that is almost your which points? These points. कौन से points हो गए ये? H7, H6, H5, okay, and almost the area of P6, not exactly P6. Now it has been seen, there have been studies done that in patients in whom you do neuromuscular monitoring and in whom you do not, patients which have a neuromuscular monitor in place, they have less incidence of nausea and vomiting, just because of the electrical stimulation from the surface electrodes. So that is a very interesting study, and there are quite a few studies. There's a Cochrane review on the use of P6 and Li4 for post-operative nausea and vomiting, right? So it has anesthetic implications also. I think one of the PGs was surprised when they thought that acupuncture has been used for anesthesia. It is being used solely for anesthetic, and in fact, there was a discovery series on that I saw quite some years back, in which they had removed a mandibular tumor just under acupuncture anesthesia, with the patient totally awake. You give a mild amount of opium, that is your morphine, pre-medication. You insert needles, and you can achieve anesthesia, localized anesthesia of that particular part to conduct surgery. And this is done in rural China. This is not a fiction. They have in China and Korea, they have proper hospitals, acupuncture hospitals, and it is quite common. It's mainly like some of these things are quite common in households also. Just like घर में हमें बोलते हैं ना, पेट में दर्द हो रहा है, जीरा खा लो, सौंफ खा लो, ठीक हो जाएगा. So that's why they have these points. They use sewing needles to prick points and take out blood. So that they say that it brings out the bad blood and cures you. Gastritis, overeating, and all those things, flatulence. So this is a household remedy in China and Korea. You prick the thumb for flatulence and gastritis and all. So these are all what? Jingle points. Any acute condition, you prick that, bring out the blood. Now, to bring out the blood, you'll have to press. So that is your acupressure along with the pricking of that jingle points. Okay. So this is how it goes. And there are no questions today from the audience. So any comments or anything? Now we'll go on and practice on hands-on. So pairs of two. Pairs of two, I'll switch on my mobile so that I can show. I'll just give me a minute. I'll switch on mobile so that we can show the points. कोई बात नहीं मैम, अभी ये हाथ पे ही करेंगे. ओके हाँ तो पता चलेगा ना. कम चलो बासुवी. ओके बासुवी. चलो डॉक्टर अनिल आप फोकस करोगे. हाँ आ जाओ. सिट हियर बी कंफर्टेबल. अच्छा ओके फाइन. कम हियर. लाइट अच्छी होना चाहिए. यहाँ पे आ जाओ, आराम से आ जाओ. He'll have a comfortable chair also. P6
40,
Sure.
ठीक है, दो ही पॉइंट्स करेंगे प्लीज। देखो ये वाला कर लेना, ये वाला 0.5 वाला यूज कर लेना,
Yeah.
ये जो SI 19।
0.5 is P6.
अपना शून करो मेजर।
चलो मैं
हाँ, 2 शून है ना,
2 शून्य है ना?
ये क्या हो रहा है, ऐसे क्या हो रहा है?
So 2.5 fingers. करो. Will be from the palmar crease, so it will be somewhere here. Flex. Okay. These are the two. Wo. Clean it. Okay. And mark the nail. Straighten it. Okay. So now I am holding the needle like this. I have marked the points. Comfortable. I'm between the tendons. I'm not on the tendon. You have to be careful. I remove the protector. Okay. And I just tap the needle. Needle is already in. Did you feel any pain?
No, sir.
No.
That is itchy. Some
Some sensation?
better say yes.
No?
Otherwise,
नहीं है, कोई बात नहीं. Feeling something?
yes, sir.
What?
Little bit of vibration.
Vibration आ रहा है ना? हाँ. So that is it. Did it pain?
No, sir.
अभी no कहेगी. नहीं, if you're feeling the pain, you tell me.
Yes, sir.
You're not supposed to move.
No, because it's not giving me any pain.
Okay. Right. So this is P6. Okay. So when you remove, all you have to do is that's it. Done. Okay. Demonstrate. SI 9 के लिए किसी मेल को आना पड़ेगा. आ जाओ. कौन आ रहा है? It might happen. इसके अंदर sorry. Keep it here only. Will do.
और जब सेंजॉय बता जाएगा सेंजॉय 14,
हाँ.
ठीक है?
So who's coming? कौन आ रहा है shoulder के लिए? Come fast. Come fast. See, you have to practice needle. You will be doing it on Saturday. You will be doing it on each other. सबके ऊपर होगा और एक दूसरे पे ही करेंगे.
सबके ऊपर
हाँ. आ जाओ. क्या हुआ? Blood? Come. आइए मैम. मैम. Sure. Okay.
यहाँ पे है ना, ऐसे को abduct करो, ठीक है? This is the highest point of the posterior axillary fold and one शून्य तुम्हारा कितना दिखाओ बेटा? 1 शून्य है ना? This is 1 शून्य. So 1 शून्य above that is this point.
This point.
This point. ठीक है?
बेटा 1 inch needle. 1 inch needle. मैम ये half inch है. See, you have to be give away the fear of being needled and needle. दोनों चीजें. You can see the length बेटा लंबे वाला होगा. हाँ ये 1 inch है.
The patient know how to do assure otherwise.
Okay. Hello.
दिख रहा है ना? Additional way. And do like this only.
So there are two ways you can directly needle, but then this will stabilize.
Point.
हाँ जी मैम. One shot. You remove the stabilizer. The needle is in situ, and with a single tap, it goes in. You remove the stabilizer. The needle is in. Then you insert it slowly.
इसको 1 to 1.5 तुम करते आएगी.
Okay.
Can you feel something? It's perpendicular to the skin.
Can you feel it? क्या हो रहा है? Feel. Tingling हो रही है ना? Pain नहीं है. Electrical current नहीं है. See. ये मोबाइल में देखते हैं. So can you see? Okay. Now this can be electrostimulated. These needles can be electrostimulated. Okay. Now tell me if you feel the more sensation. Now what I'm doing is I'm mechanically stimulating it. सेंसेशन इंक्रीज हुआ है कुछ? बहुत स्लाइट. आई एम डूइंग इट स्लाइटली. सो आई एम जस्ट rubbing it. Okay, nail से I am rubbing it. Okay, now I am rotating it. अब नहीं हो रहा. And in and out हो रहा है. इससे ज्यादा हो रहा होगा. ठीक है. So these are the different ways of stimulation. Okay, I am stimulating it now by vibration. Nail से मैं इसको scratch कर रहा हूँ. Scratching the shaft. Okay,
तो
बढ़ रहा है sensation scratch करने से.
कभी भी
नहीं.
नेल ना पूरा नहीं इंसर्ट करना.
Okay, this needle is a bit short. Stop, stop, stop.
ये नहीं.
Okay, डालते हुए हुआ था. So it pains less than a mosquito bite. A mosquito bite pains more. Okay, so मैम और कौन से points करवाने हैं?
बाकी एचपी करना है.
H3 कर सकते हैं. H3 कर सकते हैं. P6 कर सकते हैं.
P6
P6 कर दिया. We can do P3. P3. So we'll demonstrate P3. No, one of you will come and put the needle now. कौन आ रहा है? एक दूसरे पे करो. चलो. Everyone will do it. Everyone will do it. Make your pairs. चलो लो. 2 needles ये हैं. I think you can. How many you have? बेटा ये 1 inches है. 1 inch का है. You can use half inch also. You people can use half inch. ये लो. लो दोनों एक दूसरे के लिए. You'll have to do it. डरने की जरूरत नहीं है. नवनीत आजा. I'll demonstrate on you. नहीं और कौन है? 3 लोग हो तुम लोग. एक और पेयर हो गया. करो. ये तो कर सकते हो एक दूसरे को. कोई प्रॉब्लम नहीं है इसमें. नहीं तेरे पे भी होगा. तूने भी करना है. तुम दोनों का पेयर बनेगा. जो इसना कम 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 कम. चलो. Okay, so then you do pair up. Karo, please do it. Please do it. Can we have the swabs, please? Look, yellow. Hey. Pass the swabs and please practice. P3, बताओ. See, the thing is, you flex this thing, okay? This is the point, right? Middle part, यहाँ पे एक crease end हो रहा है, that is the point.
and medial
मैम वो H3 नहीं है. Sorry, that is P3. H3 is this. So these are all. This is P. H3 यहाँ ये. This is H3. This is P3.
P3 is the brachialis है ना इसके medial side में.
मैम वो lung 5 है.
Lung 5 is on the radial
Lung
side.
5 is on the radial side and
P3
middle 5
is medial
side पे. Yeah.
P3 है.
यहाँ पे H3 trees और उसको खत्म होने पे. इसके mid point में.
This midpoint.
Exactly. And P3 is middle side of the
P3, L5,
LA. हाँ. LA. Exactly. H3 is between the crease and the medial epicondyle. H3 is here. This is your P3, lung 5, lung 5 and LI. सब इसी में. एल्बो पे काफी ज्यादा होते हैं. ठीक है. तो चलो.
So now we're doing H3.
No, you do P3.
Medial crease और medial epicondyle के बीच में है. P3 pericardium में ही है. नहीं sorry.
H3 है. H3 है.
ये flex करो. तो एक यहाँ पे करा दो ना. Flex करने के बाद flex करेगा. Tendon को
medial part. ये यहाँ पे आपकी क्रीज खत्म हो रही है. ये वाला पॉइंट. ये फिट करो अब. Just relax. Okay. Mark. Yes. करना है एक दूसरे पे करो
ये दिस इज
नहीं अभी कुछ नहीं जस्ट कीप इट हाँ
उसके बाद जाके वेन्स है बेटा, देख लेना।
वेन्स पे नहीं डालना यहाँ पे करो ये लो ठीक है नो रिमूव द ब्लू पार्ट यस टैप इट firmly हाँ remove the tube hold the needle
हैंडल से पकड़ो। हाँ
हाँ now insert it till you get a giveaway that's it feel हो रहे नहीं feel हो रहे कुछ नहीं
क्या ले आया डबल डबल क्यों ले आया?
see the thing is क्या हुआ ज्यादा हो रहा है हाँ ज्यादा हो रहा है तो that's it क्या हो रहा है करंट जैसा लग रहा है या वो लग रहा है आ रहे हैं ना यहाँ पे मतलब there is some pathology your energy is not proper so let it be okay 10 to 15 minutes initially then it will depend on that okay चलो remove
दिस इज P3 ना,
P3
P3 है तो थोड़ा सा ज्यादा मीडियल हो गया है। इट शुड बी ऑन द जस्ट
लेटरल
मीडियल।
जस्ट यहाँ पे मैम वेन था इसलिए हो गया था इसलिए टेची में थोड़ा ज्यादा टेची आ रहा था इसमें okay so any questions any this thing we'll be practicing here so if you can you practice on your own please and with that we'll end the live session today I'll switch on the camera so with this we'll end the live session and I hope you'll practice and if there are any questions we'll be happy to have your questions so any questions any questions okay Faraz can we end the meeting now
Yes, sir. Sure, sir. And thank you so much once again. Hope connect tomorrow.
yeah
Bye,
thank you
sir. Take care. Wonderful session.
yeah thank you